and welcome to the Black Dental Reserve podcast. I'm Dr. Bridget White, and today we are joined with Dr. Julia Jackson, an oral and maxillofacial surgeon here in Northern Virginia, who is actually the only Black female oral surgeon in the entire Commonwealth of Virginia. So she knows firsthand how imperative it is to increase the number of Black dentists and surgeons. So, known by her patients and colleagues as Extraction Jackson, she and I go way back to our school days growing up in Philadelphia. Dr. Jackson is an author, professor, clinician, and researcher. A Wesleyan College alum, her training includes dental education at Temple University, Kornberg School of Dentistry, oral surgery internship at the Brooklyn Hospital Center, and residency at Howard University. So without further ado, please welcome Dr. Julia Jackson. Hey, girl.
Hi, how are you? Thank you, Dr. White.
Oh, you're welcome. So how you doing? It's a Friday afternoon, and we're getting into this podcast for the Black Dental Reserve so that we can increase the number of Black dentists. And the current dentists and the future dentists, we want to create economic opportunity for us to thrive and continue to help people live happy, healthy lives.
I'm healthy and motivated for the future.
Well, tell us a little bit about yourself. I mean, your practice, what inspires you to pursue dental medicine and specifically oral surgery?
While attending my last few years of college, I was a psychology major and I was accepted into the master's degree program for psychology. I had applied to dental school and I was accepted to Temple Dental. And within the first 3 years, I fell madly in love with oral and maxillofacial surgery.
People think of surgery and they're like, ooh, that seems gruesome. Like, I mean, what was it? Was it the human body? Was it just reconstructing the face? What kinds of things, what is it all about for somebody that has no idea anything, not even about wisdom teeth? They hear oral surgery and they think, are you making a new mouth? What is it?
Oral and maxillofacial surgery is the pinnacle of dentistry. There are 7 or 8 different kinds of dentists, but oral and maxillofacial surgeons help patients from the cranium to the clavicles. I had the opportunity to shadow many of the surgical residents at Temple University Hospital. I was able to spend many, many hours watching them, seeing how they were performing the procedures. I was intrigued by the pathology, the trauma, and the day-to-day life of being an oral surgery resident. I loved oral and maxillofacial surgery. It was my password name. My life revolved around oral and maxillofacial surgery. My blinders were on. My focus was to become an oral and maxillofacial surgeon.
Did your parents encourage this career in healthcare? How was your family? How did they facilitate supporting you in your pursuit of dentistry?
My dad was a strong influence. He was an electrical engineer. He always liked to work with his hands. We would always build things and create things, take things apart, figure out how they would work. My mother was a very strong supporter and advocate of education. So whichever direction I was going to go, I was certainly going to go to the top.
Mm-hmm.
When I graduated from Howard University in 2011, after completing the 4-year oral surgery program and a total of 6 years of oral surgery training, I was fortunate enough to fulfill my dream and my father's vision to become an associate with Dr. Franklin Scott. In 2011, I moved to Philadelphia to live in an apartment building about 6 minutes away from my new job. We had the arrangement that I would work on Monday, Wednesday, and Friday. He showed me the ropes. He taught me how to run the business, and he encouraged me and nurtured me and supported me. I was able to get my team together as an independent contractor. I got an accountant, a contractor lawyer, and I started an LLC. I was paying my own malpractice insurance. I was working at my leisure on Tuesdays and Thursdays, or I would get my car washed or my fingernails painted during my off days. I saw how good life could be, and I saw the challenges that Dr. Scott exposed me to, the trials of being audited, the importance of making sure my taxes were completed and business expenses. I got the school of hard knocks. I understood every role of the team, including billing, scheduling, and marketing as a specialist. I figured it out. I realized the aspects of oral surgery aside from the clinical presentation. I planned that I would buy Dr. Scott's office. I was 33 years old, not married, no children, free and independent, mentally and physically. My long distance relationship with my boyfriend, who lived in DC, was just the kind of space I needed. 2 years later, I accepted his marriage proposal. What I didn't consider is that he didn't want to live in Philadelphia.
Well, let's back up. Let's back up. So, Dr. Franklin Scott, is he still practicing?
Yes,
In
he is.
Okay, and just to let y'all know, he's also a mentor of mine. Dr. Scott, he extracted my wisdom teeth as well as many of my family members'
He
wisdom
extracted
teeth.
my wisdom teeth.
So thank you, Dr. Scott. I have all praise to Dr. Scott and his staff and just supporting the as a student at Penn and Temple, like Dr. Scott, is such a great support to us. But let's talk about your journey. People don't think about what dentists study in college. Was it a pre-med pursuit? What was Wesleyan like with regards to preparing you for dental school? And then, just walk us through all of that and how long was that journey? When people think of oral surgery, that obviously requires training beyond dental school. How long, did you go to dental school immediately after college? Just tell us all about that. Let's slowly walk through those years.
Well, as I mentioned, I was a psychology major. I took the pre-med prerequisites. So the plan was that I was going to become a doctor. And so getting into the psychology master's program would have gotten me to become a psychologist. But I wanted to do more with my hands. And when my father made the suggestion to pursue and look into dental school, where I could physically use tools and utensils to create, I thought, well, I don't know about that. I'm not sure if that's the right thing to do. I had a friend at the time who was going to be a podiatrist. And a podiatrist is someone who is a surgeon for feet. So we joked that she would fix feet and I would fix teeth and feet. So in the thought process, when I finally did get accepted to Temple Dental, I thought, okay, let's see how this is going to work out. The first 2 years were very overwhelming and uncomfortable. I was depressed and um, not happy with what was going on because of the challenges of the academics, some of the relationships that I was exposed to were adversarial and not positive. I was feeling as though I was down and not motivated. I didn't find my true passion and true love until we got into the third year of the program, which is when we have our clinical experiences.
Your experience at Temple was not particularly nurturing, and it's really disappointing to hear that. But unfortunately, I would imagine many of our peers and our colleagues may have had similar experiences, and I would hope that this changes so that future dentists don't have to go through that. Could you share more about the resistance that you were met with as a student at Temple?
Resistance never lets up. It's not as if you go through resistance in graduate school and you're not going to have resistance in residency. You're not going to have resistance in private practice. You're not going to have resistance in life. So these challenges that I did face in dental school only made me stronger and more resilient for life after. The academics at Temple Dental were rigorous and challenging. The requirements were demanding and heavy. So just being a student tested one's limit of discipline and perseverance. Then the obstacles came, like noticing that teachers were not especially encouraging or nurturing at times. It seemed like they wanted me to fail or didn't think I should pursue oral and maxillofacial surgery. I had a tendency to hang out in the oral and maxillofacial surgery clinic, and the instructors didn't seem warm or welcoming. Instead, they would ask, "Why are you here? Haven't you finished your requirements for the other clinics?" As if I didn't belong. I would sit and insist that my other requirements were managed, and I still would find time to be in the oral surgery clinic, and they would tell me that the volunteer capacity was full. No more volunteers in the clinic today. We have enough people. I say, how can you have enough people? I want to be in there. I want to be doing this. I recall an especially disappointing circumstance where we were informed that we would be selected for a Haitian mission trip for oral surgery students to go to Haiti and help in the clinics. My maternal grandmother is from Haiti. And so I knew this was a wonderful opportunity for me to be able to serve the community and visit a place that my family was from. I was captivated by going on this experience, and I was eager to apply, but I was not chosen for the trip. A satisfactory answer to why I was not selected was never given. Again, I was sidelined from an opportunity that would have only made me a better oral and maxillofacial surgery candidate for residency.
Well, good for you to continue on. How did you steer out of that and make sure that you made it? What did how'd you pick yourself up? How did you, because that's hard. It's hard. You're in there, you're in the trenches, taking tests, board exams. What was it, your inner voice? Was it your family? Was it Dr. Franklin Scott? What really pushed you to say, you know what? Keep your nose to that grindstone and carry on. What was it?
I'm an extracurricular activity kind of girl. So if my academics were challenging, I would find other ways to boost my appeal. So, for instance, I was also a lab rat. I would stay in the lab. The We had a dental lab where we would have to put small teeth on our dentures so that we could make sure that they eventually were cured so that the patient could wear the denture. I would just always try to do extra activities. If they said we needed to make 3 dentures, I would make 4. Or if they said you needed to do gold crowns, I would make more gold crowns than were necessary. I was always doing more than whatever my peers were doing. If they said, "Oh, you need to do 2 internships," I would do 4. I would find the time, I would find the space, I would find the way just to have more exposures. I would spend longer hours. I would try to immerse myself completely in oral and maxillofacial surgery. It was my life. It is my life. My life has changed, but I was completely all about oral and maxillofacial surgery. I don't know how to explain it, but that's the best I can say, is that you have to put your entire self into whatever you're doing so that whatever anyone else tells you, they cannot deter you from your path.
Yeah, you hit it right on the bullseye. You have to be about it to achieve it. And I think that all of those, all that extracurricular effort, all of that passion is why you're able to perform now and provide those services. I would imagine that just having more Black faculty, having more faculty from our community would is compelling. It's nurturing. It's having that, knowing that someone is supporting you. That's one of the reasons I went back to teach at Penn Dental, because I saw the lack of representation, and I actually appreciated the faculty and the cultural competency that was, uh, taught as a student at Penn. And I went back. I said, just for visibility, these students need to see me. And then the Black students need to see me. The patients need to see me. So I look at this, our representation really, there's so much room for growth, but it's going to be us. It's going to be the Black dentist, the current Black dentist that helps groom the future Black dentist.
As soon as I took out my first tooth, it's an experience that I have difficulty expressing because it is unlike any other. It's like having a challenge that you know that you can do. You've seen other people fail and you want to pursue to do, and you have to be very careful. You have to be mindful that this tooth is attached to a person. Never forget that the person is who you're treating. It's not really the complication of the tooth if it's broken or if it's infected or if it's moving. The point is, don't forget about the person. And when I started to have more engagement with people clinically in the third year, my eyes were opened that this is exactly what I want to do. I could take out teeth all day. I love it. I absolutely love it. There's a physical rush that I feel, almost like a climatic experience, because at that point, there's so much tension and so much nervousness. There's so many emotions going around. The patient can be nervous, they can be overwhelmed, they can be scared. The tooth itself, you certainly don't want that to break, or you don't want it to make it a more of a challenging procedure. Now we have to look for root pieces or root tips. So there's a point where everything comes together. And the joy I have to say that the tooth is on the table and the person is looking at me wide-eyed and overwhelmed that this problem that they've been carrying has now been resolved just simply by the delicate nature of my touch. I can't get any better than that. It's every single patient brings me joy.
So it sounds like just once you started engaging with patients, that's where you really were able to, flourish and actually realize how much you loved treating patients. A lot of people probably, I mean, myself included, those first years of school are very didactic. A lot of those sciences, for me, I was not a science major. So I remember thinking, how much science are we doing here? Let's get to the teeth. Were there any challenges that you felt you faced because of race as a Black student specifically? And if there were challenges, what do you think could have helped you more?
The challenge was not because of the color of my skin. The challenge was because the people that were my teachers didn't think that I was capable. Perhaps because of the color of my skin, or perhaps they just thought of oral surgeons differently than me. They believed that I should continue with my denture requirements, continue with my hygiene requirements. They were dismissive of my enthusiasm that oral and maxillofacial surgery was the path that I wanted to take. They tried to deter me from my goals and lead me in other directions, distract me, find ways for me to be doing something else instead of what my mind's eye said was the right path. Um, they did not believe in me for whatever reason. There was no one who said you could do it. And so that part of dental school was empty and unfulfilled. I had to find it within myself, from my family. Even my mom didn't really understand why I only wanted to take out teeth. Like, that just didn't get that part to, well, what is it that you want to do for every day? Why would you want to take teeth out? It's very hard to put explanation to the joy of being able to do something that other people can't do. And I'm not talking about, I'm sure there's other oral surgeons who take teeth out. I'm just saying that there are so many patients who have had horrible experiences where they are nervous to even come into the room because of whatever they have gone through in the past. I just find really satisfaction in being able to help people who need my help.
I would think your patients are, especially when they meet you, are just feel relieved and feel relaxed. You have a great way of making people feel at ease. And specifically in our community, although Black dentists are severely underrepresented, we make up only 3% of the dental workforce versus our 13% national population. We actually shoulder the care for 50% of the Black population. And a lot of that has to do with access. A lot of that has to do with Black providers being visible, being available. And then, of course, the past traumas that many Black patients have felt because of not being treated well by providers that don't look like them. There's so much research available that shows that patients are more compliant, have better outcomes with doctors who look like them. And I think your testimony to your technique, your training, and your ability to care for the patient, that relationship sounds like it has a lot to do with, with the color of your skin, with your experience, your lived experience as a Black woman in the society, coupled with your high skill level. So it sounds like my mother also had a lot of whimsical things to say about teeth. What are you learning in school? What are you going to do to the teeth? I think just most people don't understand how comprehensive dentistry is, and then specifically surgery. Could you give us just a brief overview of the different types of procedures that you do in terms of reconstruction, facial plastics, things like that? Because a lot of people may know Extraction Jackson. I think on a Friday you take out 35 teeth right before
So,
you go to happy
so,
hour.
so, so first I'll say dentistry is a relationship between art, science, and people. So dentistry in its whole, we there's a science to the medicine of dentistry. So we have to know the pharmacology, what kind of antibiotics, what kind of pain medication, what kind of medications to help with swelling. We need to know what kind of anesthesia to properly administer. We need to know how to make sure the patient is comfortable within the science of dentistry. We also need to know very carefully, how do bones come together? How do the cusp of each tooth fit together for form and function? So the science of dentistry certainly keeps me mesmerized. The art behind dentistry is your own talent. The art is trying to make sure it's the right color or the right shape or the right size. Make sure that it fits well. Make sure that the art of it is that it looks nice. Make sure that things are functional and things make sense for the patient's perspective. And then the people part is the patient's perspective. Is the patient happy? Is this person who's miserable and has had previous dental trauma? Is this a person who is happy with their smile but needs minor adjustments to be made? Is this a person who is having swelling? Is this a person who is having tooth pain that's keeping them up at night and wants to know, why is this happening? So the mixture of the art, the science, and the people certainly captivated me and pushed me into the direction of, well, what part of dentistry truly is the part that makes me happy? Now, as I say, oral and maxillofacial surgery is from the cranium to the clavicle. So it is a broad spectrum specialty. We can help patients with pathology. We can help patients with trauma. Trauma is if someone falls down and breaks their jaw, I can put it back together. Pathology is if they have a cancerous lesion in their mouth, I can biopsy it and send that specimen to the pathologist so they can look under the microscope to see the cells that are present, which would then tell us what kind of treatment would need to be rendered. The oral and maxillofacial surgery also includes orthodontic surgery. How do the jaws come together? Does the top jaw need to be changed in its position to relate in a symbiotic relationship with the bottom jaw. Oral and maxillofacial surgery also talks about how is the jaw joint, which is called TMJ. But the bread and butter of oral and maxillofacial surgery is dental alveolar. That means teeth related dentistry in surgery, such as sometimes when a person is going to be getting new teeth, like a denture, there's bone that needs to be smoothed. So one of my very favorite procedure is called tori reduction. It means that we are going to reduce the amount of bone that may be found under the tongue or on the sides of the cheek that are obstructing the general dentist's ability to get a denture to fit properly. My job is to make sure that the foundation is solid, that the sites are healthy and clean, that things are in good condition for the dentist to then be able to do their next steps. In addition to removing of tori, if a patient needs their wisdom teeth removed, we put patients to sleep. Oral and maxillofacial surgeons are the only specialty in dentistry that sedate patients. There's a new specialty in dentistry called dental anesthesia. I'm not very familiar with it, but I do believe it is just putting the patient to sleep. Oral and maxillofacial surgeons, we put the patient to sleep and do the surgery at the same time. Sometimes my patients will ask me, who's going to be the anesthesiologist? And I just easily tell them, well, part of my 6 years of oral and maxillofacial surgery training included anesthesiology. I will be putting the patient to sleep and waking the patient up. So there is different parts to oral surgery. It's not all facial cosmetics. It's not all reconstruction. As I said, my bread and butter is to take out teeth that can't be fixed, that are not in good condition, maybe that are broken. My job is to reassure someone who is especially nervous or anxious by giving them anesthesia to calm their anxiety and to be able to then perform the surgery. I also very much enjoy sinus lifts, bone grafts, membranes. I have an Instagram site called socket underscore grafting underscore girl. And on that site, my goal is to show people almost like a recipe of when you take a tooth out, how you are properly supposed to prepare the site for a dental implant in the future. We can't just take the teeth out. You have to talk to the patient about function after the extraction. And that's key to having a dental implant or multiple dental implants. If we put multiple dental implants in, the patient is then going to be wearing a denture. There is a hybrid to the denture. The one that you may be thinking of for someone much older than you, they put some adhesive or fixodent and they put this plate in their mouth. It's a little bit gooey. It's moving around. Maybe grandma lost her teeth when she was talking. A hybrid denture is a denture that involves utilizing dental implants to anchor in the bone so that now we don't need to use fixodent. I had a patient who came over to me. She bought me a bottle of champagne. Now, I'm not someone who drinks very much, but this was my first bottle of Dom Perignon. And the reason she gave it to me, she said, you have changed my life. You have caused me to be able to appreciate things that I used to appreciate that I could no longer. It was almost as if it was a paradigm shift. She was wearing this bulky plastic denture, and because we had placed 4 to 6 dental implants in the upper jaw, the new denture was now just a horseshoe. And so she was telling me that she could enjoy the bubbles of the champagne on the roof of her mouth and that she wanted me to enjoy them as well. I said, okay, no problem. Exactly. Cheers. If you feel great, I feel even better. So I mean, I do help people make changes for the better, but not necessarily in a reconstruction of the facial skeleton. I am no longer treating patients in the OR. All of my surgeries take place in my 3 office locations in Annandale, Woodbridge, and Manassas in Northern Virginia.
Well, let's talk about your business. That's a big part of the field of dentistry that a lot of people don't know about. We are entrepreneurs, business owners. When did you decide to go into business for yourself as opposed to working for another office? When did you make that leap? And tell us about those steps.
Well, actually, I am not in business for myself. My fiance wanted to move to Washington, D.C. Dr. Scott was very supportive, but I could see the disappointment in his eyes. He had groomed me to be his legacy. And this was a big decision that I was going to figure out. Was I going to stay with Dr. Scott or start a new life in a new city? I eventually did move to DC, no job, and a big ring on my finger. And I had to figure out what's next. I had to start over. I started as an independent contractor, but this was not my hometown anymore. This was a different environment and a different demographic. I was moving to the South, my mother liked to remind me, and I needed to be prepared for those kinds of relationships living in Annandale, Virginia. I found a group practice that was owned by a dental support organization. A dental support organization is when a corporation purchases a private practice and tries to implement managerial, billing, and scheduling techniques so that the private practice can continue to flow. What that also means is that it takes away from the responsibility of the clinician to keep the lights on, make sure that the receptionist who's going on maternity leave has coverage, make sure that there's toilet paper in the bathroom, all the things, the small details Dr. Scott was responsible for the business aspect. This DSO takes the responsibility away and just gives the clinician employment. So when I moved to Annandale, I was and still am an employee. I have been working in Annandale for 9 years. And my only responsibility day in, day out, the schedule is full. My days are satisfying with oral and maxillofacial surgery procedures, including extractions, implants, tori reduction, bone grafting, and sinus lifts. Nothing I can't handle. I've been working at the same job for 9 years and I've been married for 10. I have the only business that I actually own is a real estate business. I own several cash flow properties and a property management company so that my cash flow properties are always satisfied. If the tenant needs something, or if we need new appliance, or if the grass needs to be cut, or if the rent needs to be paid, or if there's a penalty for the late payment of the rent, that's the business that I own. There will be a day that I walk out of my oral surgery practice and don't look back.
Wow, you got yourself set up. That's amazing. That is, I think you hit on so many points. Number one, distinguishing. Thank you for distinguishing between solo practitioner, solo practice ownership, and working with a dental service organization, a DSO, as you noted. That is a big part of the profession that I think every dentist will say they were not prepared for. It kind of gets cut out of our education because our education requires so much, and of course, year by year, it becomes even more comprehensive. But then, for you to enjoy real estate, that's such a booming, growing area, and so different from healthcare. So, do you miss Philly? Do you think you'll ever relocate back to Philadelphia? Would you call Virginia your home now?
Virginia is my home now. I visited Philadelphia recently for Mother's Day, and It's good to be home in Philadelphia. But I think one of the best things that happened was for me to leave because I was able to see what the world has to offer.
Well, that's excellent.
Dr. Franklin Scott was my dad's tennis partner. So my dad saw what Dr. Scott was capable of doing. He saw the entrepreneurship of Dr. Scott. He saw the independence of Dr. Scott. He saw the work ethic of Dr. Scott. He saw that these were things, he saw the lifestyle of Dr. Scott. So it was almost like my father saw somebody doing something that he knew his kid could do too. And he encouraged me to figure out how can I do that. And I did. I figured it out. My mom helped me with all my application processes. My father's only continued to support me and encourage me. Um, and so once I did get accepted to Temple Dental and then eventually go on to Howard University Oral and Maxillofacial Surgery residency and finish in 2011, it was almost just like it was meant to be. I was going to be working with and at Dr. Scott's office.
It sounds like Dr. Scott proved to be a mentor, and then also, even though you didn't ultimately purchase his practice, you inherited his skill set, his confidence, his blueprint. And I think that that's something that is is so important in any profession, and it's something, there's a reason why we have to continue to inspire the up and coming future Black dentists. We need to talk to them at every level, from kindergarten through fifth grade, introduce them to science, um, talk about how dentistry involves art, how it involves technology. I actually think that we can increase the number of engineers or computer science students with those types of backgrounds to venture into the field, not only as clinicians but even perhaps as industry
One of
leaders.
the best bits of advice that I received was during my time of finishing dental school. At the time that I finished dental school, this was 2005. I knew I wanted to be an oral and maxillofacial surgeon, but I wasn't exactly sure how this was going to work out. I also knew that oral surgery was a 4-year commitment. So I wanted to just do a 1-year internship. And if I ever had to give somebody advice, my advice would be don't limit yourself. I put a specific program that I only wanted to get into University of Penn with a oral surgeon named Dr. Raymond Fonseca. After leaving Temple and being so deprived of nourishment, being so deprived of being nurtured, I was lost and wanted to be in an environment in oral surgery, but also something that seemed a little bit more comfortable. And so I thought, I want to go to University of Penn and I want to be under the tutelage of Dr. Raymond Fonseca. I would follow the residents. I would hang out around the school. I would be at the hospital night and day, and they didn't pick me. And I was devastated. I went back to my apartment and I sat there to figure out, well, if I'm not going to get into that 1-year program, what am I going to do? And it was almost like within the next few days, I got a call from Brooklyn Hospital Center in New York, and they said, hey, we have a 1-year program. Would you like to come to New York? So again, this was another time where leaving Philadelphia opened my eyes to new things. This was my first time living in Brooklyn, New York. I had an apartment, and the way that it was set up is that I lived on, let's say, the 12th floor, and I would take the elevator down to the 2nd floor and I could walk over a bridge to get to the emergency room. Like I didn't even have to leave my house really to get to the emergency room. We'd be in there at 4 and 5 in the morning, drunken, bar person who had gotten beat up and his mouth is bleeding. We have to put his jaw back together. we'd let him sleep it off. I'd go back upstairs, sleep an hour, come down. Is he sober yet? So it gave me an opportunity to be right there when I needed to be and fix their concerns and then keep it moving. But after finishing the 2 years, I ended up doing 2 years of a 1 year program. And then my advice is not to put your blinders on with regards to your options. Never limit your options. I said I only wanted to go to Penn. I ended up in Brooklyn. And I think that just carried through with all of my other education, where I would not say, oh, I'm only going to go to one program, when in fact you have so many options. You should apply to as many programs as you possibly can, because if I ever give a little bit of advice, the best program in the country is the one you get accepted to. It doesn't matter which one it is. It's the one that accepts you, and then you get in and you fulfill your responsibility. The other advice that I received in my navigations of residency, and this was from the program director in California. There was a point where I had finished my 2 years of internship in New York, and I was going to apply to programs all over the country for oral and maxillofacial surgery, 4 and 6 year programs. And I had visited California. I was at a hospital called King Drew at the time. And the program director said, we want you. We're going to hire you. We're going to enroll you. We want you. You're coming to this program. We want you. I said, okay. He said, and by the way, when you are accepted to a program, make sure you purchase the home that you're going to live in. Don't rent, because you're going to be in this home for 4 to 6 years. That's a piece of advice that stuck with me since 2007. So to make a long story short, the way that you get picked for a program for residency is through a match. And so you're only going to match with one program. The program that matched with me was Howard University. I was shocked because I had applied to 25 schools, but I thought that King Drew was going to select me. I called King Drew with my Howard acceptance, and I said, "What happened?" And they said, "Well, we wanted to make sure that you got accepted to a program because our program is falling apart. And we don't know if our program is going to continue for the next couple of years. We didn't want to take you and then tell you our program is falling apart. We wanted you to be matched up with a program and then have the choice of whether or not you wanted to come with us and see if our program was going to continue." Well, their program continued. But part of the advice that the program director told me is go to the program that has accepted you. I said, Howard? He said, yes. I said, and buy a house? He said, yes. I said, okay. So now I got to figure this all out. 2007 was the first property that I purchased. It's a studio apartment it's on 2nd Street and Howard is on 7th. So it's a 5-block walk. And again, I could go to the OR and come back to my property and be within walking distance of my responsibility. I still own that property today. That was the first property that I purchased. I've purchased several since then.
Oh, so you guys set up really, really early with the real estate. And how did you do that? I mean, how'd you purchase real estate, essentially on a residence budget?
New York is one of the highest paid per capita. You get paid very well in New York. But the rent is very high in New York. So because I was living in this building that was attached to the hospital, it was part of the residency program. So the rent was included. So all the money that I was making, I got to save. I didn't spend any. I didn't have a car. I lived in the building. I didn't have I didn't have a mortgage. I lived in the building. I didn't have any expenses. I would eat the cafeteria food. So the money that I had collected for the 2 years that I was there was the down payment that I was able to utilize for my condominium in Washington, D.C.
That's something that everybody needs to know. All these jewels, all these gems that you
Mm-hmm.
did receive. So let's just recap. You were at Temple the first 2 years specifically. You didn't feel the faculty were very nurturing. You felt would you say isolated, but you persevered. You handled it. You crushed it. What what do you think? I mean, with your own experience, what efforts do you think the field, our profession, the institutions need to incorporate to increase the inclusion of Black students, Black dentists from a dental school level and then into
Well, I can
residency?
only start with myself. I can be encouraging to students that reach out to me from my Instagram post, socket underscore grafting underscore girl. In July, I will be a guest speaker at the National Dental Association Conference in New Orleans, which is to help and encourage new dentists and dentists in the nation to participate at the conference and learning new tools and techniques. My presentation will be the discussion of oral and maxillofacial surgery pearls on socket grafting. And most recently, I have agreed to be an alumni interviewer for Temple University School of Dentistry. I hope to get more students of color accepted to dental school.
You have done so much, and just your career is still blooming. I see great things
Thank you.
ahead. It's exciting for me. I tell you, when I first got your referral form and I saw your name, my heart lit up. I said, "That's my girl over there." The oral surgeon right there is my friend, and my patients have specifically asked, "Can you send me to a Black surgeon?" And I say, "Yes, I can." Dr. Jackson is waiting for you. And then to know that you are the only Black female oral surgeon in the state. I mean, what do you want to say just really to our community of dentists? What do you want to say to the other surgeons? Are they aware that we are so underrepresented? Do you think there's any regard for that, any concern, or it's just status quo, keep it moving? Hey, Dr. Jackson, do you ever get any curiosity from your
I
peers?
think what I would say to the people, to the students, to the one dental student who is struggling and feeling down, you can do it too. You can do it. You can do it. You can do it. You can do it. If I can do it, I know they can do it. That's first and foremost. New dentists, you can do it. Dentists who are questioning, you can do it. I just would only empower others that oral and maxillofacial surgery, like I said, is the pinnacle of dentistry. It doesn't, there is no stopping this show. It is the best place to be. And to my peers who may or may not know that I even exist, that's okay. You don't always see a rainbow, but you know that there are promises out there, and you know that there are wonderful things that some people may not even understand. So I may just be confusion to them. I don't know. I'm a colleague of theirs. I've been through the trenches. I've been through the academic uh, uh, challenges. I would just say to my colleagues, I'm here, and I know that there's something that I can contribute to conversations. There's something I can contribute to the Oral and Maxillofacial Surgery Society. Um, but I would just simply say to those that are pursuing dentistry that you can do it. And if you need, I'll be here to talk with you.
Well, thank you so much, Dr. Jackson. I'm going to leave in the show notes. We'll have all your contact information. We look forward to your presentation at the National Dental Association convention. Thank you, Dr. Jackson.
Absolutely.
Keep popping the molars, girl.
Absolutely. I took out more teeth in dental school than anyone in my class or the class before me.
Okay, that's spicy.
Yeah,
You
that's
see, that
spicy.
needs to be on the
Because
wall.
I
That needs to
like
be
to
on the
take them
wall.
out and I'm good at it. What can I say?